everybody. Welcome. Thank you for being here tonight. Welcome to all those people who are watching this live stream, which is nice from the comfort of your sofa. So I'm chair of Carpenter Chapter 36 for Barrie and surrounding areas, and I'm pleased to co-host tonight with my fellow partner. This is Leo Brooks from the National Association of Federal Retirees.
How do you do? I'm very pleased to be here tonight, and I would like to thank my colleague Gwen for chairing, who is the chair of the Barrie CARP chapter, for allowing us to cooperate together. CARP has had a lot more experience than us, but by joining their membership and reaching out to our membership, we can have a much better democratic event, at least we thought, and she was very welcoming to the idea, so I'm very happy for that. Tonight, earlier this evening, we did Barrie Innisfil, and we had people that lived in that riding, and we had 3 candidates here, and we did a fireside chat as well. Tonight we're doing, obviously, Barrie-Springwater Oro-Medonte, and we are lucky enough to have 4 of the parties represented, so welcome. We have prepared a very interesting evening for you, we think. We've given each of the candidates 3 prepared questions, so they should come well-versed and well-armed to respond to the questions that they're going to be getting tonight. And we also have a fireside chat, which will give you the opportunity to get an insight into each of these candidates. The earlier fireside chat was very interesting, chaired by Martin, who is doing our interviewing. So we hope you enjoy this evening, and we hope that you'll find it interesting, informative, and worth your time. Thank you.
And I want to thank our 4 candidates for coming out tonight and for joining us in this. I really appreciate you all. I want to mention Rogers TV, who is here filming tonight. They will edit, and it will be on Rogers TV Thursday and numerous times after that, they tell me, which is all great exposure for everybody. And we are also filming, of course, and it will be on YouTube and Facebook until June 2nd. So lots and lots of exposure. So, you know, you're on the mark. Pardon? Yeah, and so I want to thank all our volunteers tonight, too. And I want to thank Stephen from Audio and Visual for, again, carrying us through all this. And I just want to mention Bradford Nursery, because they provided this little bistro over here for our fireside chats. So I'm going to let Martin take it away, except I just want to introduce him. And I'm going to read this because, of course, I'd never remember all this. So Martin is currently pursuing a PhD in the interdisciplinary studies on contemporary social issues through St. Paul's University, where he is part of the International Imagining Age-Friendly Communities Within Communities team, which is supported by the Social Sciences and Humanities Research Council, and which builds on the World Health Organization's global initiative. The podium is yours, Martin.
Thank you. Thank you, Gwen. I'm very glad to have everyone here. And so I'm just going to start us right off. I'm going to talk about the format, so there'll be no surprise. We're going through 3 questions. I'm very glad to have all the candidates here. So Elise Robinson from the Green Party, Jeff Lehman from the Liberal Party, Beverly Pacho from NDP, and Doug Downey from the Progressive Conservatives. So what I'm going to do is I'm going to read the background of each question. And then actually, when we go in that sequence, the same sequence I've mentioned alphabetically on the first question, I'll mention the person's name and I'll reread the question again. And each person will have 5 minutes to answer. If you happen to be going over, I'm just going to ring this bell to give you a heads up. And we'll proceed from there unless there are any questions. Everyone's okay? Great. Okay. So the background of the first question deals with reforming long-term care for seniors. Seniors currently represent 19% of our population, and this is expected to exceed 24% by 2030. Seniors have concerns about the state of older adult care in Ontario and the lack of willingness of our provincial government to commit to long-term care with standards, accountability, and for long-term care that serves Ontarians' best interests. During the pandemic, we witnessed the lack of adequate care in LTC facilities, the overworked and underpaid staff, the lack of standards, and the high death rate where long-term care residents represented 20% of COVID-19 cases in Ontario, but 65% of COVID-19 deaths. Clients experienced reduced access to services like bathing and cleaning, which were unbelievably deemed non-essential. In 2020-2021, Ontarians waited an average of 188 days for placement in long-term care, which was an increased 29 days over the 2019-2020 period, and 38,000 waiting to get in. So I'm going to pose the question, and it'll be to Elise first. So the question is, what would you do to improve LTC for a growing senior population and ensure Ontarians across the province have access to well-staffed, well-run, and safe LTC facilities?
The first thing I would do to ensure our growing senior population has access to well-staffed, well-run, and safe long-term care facilities would be to repeal Bill 218, which shields long-term care owners and operators from liability for negligence. This is especially important in for-profit homes because it shows these owners that they can't get away with sacrificing their quality of service for the sake of saving money. A Science Table report from January of 2021 stated that Ontario's for-profit nursing homes had 78% more COVID-19 deaths than nonprofits. This overwhelming number is caused by chain ownership, crowding, and older design, which all drastically increased one's risk of dying from COVID-19. And at that exact same time these deaths were happening, for-profit operators were paying nearly $171 million in dividends to their shareholders, money that could have been spent reducing crowding, updating their facilities, or improving the wages of their frontline workers. But it wasn't, which is why the Greens believe we need to phase out for-profit long-term care and stop licensing new for-profit homes. The sad truth is that these facilities have shown us that they do not exist to provide quality care for their residents, but to provide profits for their shareholders. To increase resident safety, we will also reinstate annual comprehensive inspections of long-term care homes without advance notice, and ensure homes with infractions face the legislated consequences, which starts with transferring regulatory oversight of retirement homes to the Ministry of Long-Term Care. We will also create a system of formal oversight for long-term care medical directors working with the Ontario College of Physicians and Surgeons and the Ontario Medical Association. And while these reactive measures are necessary to protect residents, they are not our only solutions. Funding to long-term care requires a much-needed boost, which is why the Greens will increase base funding for long-term care by 10%, build 55,000 long-term care beds by 2033, and at least 96,000 by 2041. We will also legislate staffing in long-term care facilities to include a minimum of 1 nurse practitioner for every 120 residents and a staff composition that includes 20% registered nurses, 25% registered practical nurses, and 55% personal support workers. But to ensure that these facilities successfully meet those new legislative requirements, we must improve the wages and collective bargaining power of those staff members, which is why we will immediately repeal Bill 124 and the problematic sections of Bill 106 to allow all healthcare workers to bargain collectively for fair wages. And until that legislation is repealed, we will provide a minimum hourly wage of $35 to registered practical nurses and $25 to personal support workers. But we also need to ensure that we can retain those workers by providing them with adequate mental health care services. A provincial study released last summer reported that 50% of personal support workers leave healthcare within 5 years, with 43% leaving because of burnout. We need to extend mental health care under OHIP so these workers are able to access the support they need to remain in this industry. And to make sure these facilities are well run, we will mandate a minimum of 4 hours of nursing and personal care per resident per day, including a minimum of 48 minutes of care provided by a registered nurse and 60 minutes provided by a registered practical nurse. We will also increase resident access to allied health professionals such as dietitians, physiotherapists, occupational therapists, and social workers to a minimum of 1 hour per day. And prioritize healthy, quality local food as an important component of resident well-being. Lastly, I will heed the call from the Alzheimer's Society's roadmap to a renewed Ontario dementia strategy by working to implement all of their recommendations regarding long-term care for seniors with dementia, which includes, but is not limited to, implementing an emotion-focused model of dementia care that encourages long-term care staff to look at increased quality of life of dementia clients as a main indicator of their practice, and ensuring that investments towards long-term care homes facilitate the adoption of dementia-specific programs and well-trained staff to care for residents living with dementia. All the solutions I've laid out are part of a comprehensive plan aimed at providing our seniors in long-term care and those who work there the best overall quality of life, because care should be unconditional. Thank you.
Thank you. So, Jeff, I'm going to read the same question to you. What would you do to improve LTC for a growing senior population and ensure Ontarians across the province have access to well-staffed, well-run, and safe LTC facilities?
Well, thank you very much for the question, and thank you to CARP and the organizations for organizing tonight's debate. The short answer to the question is our party is proposing to end for-profit long-term care in Ontario by 2028, but I think more importantly and right away to put the focus on home care. And I'll come back to that in a moment, but I wanted to mention off the top, you know, making our way through the last 2 years, first of all, we have seen just what a disaster mixing the profit motive and long-term care is. And as we worked through the pandemic at the city, one of the things we tried to do was to provide support for our residents here in Barrie in long-term care, including providing iPads and technology to try and fight isolation. And I think, you know, whenever we talk about long-term care, the first and most important question should be, how can we keep people at home longer? How can we give them support at home to remain at home longer so that they don't need long-term care? We are, of course, going to need a long-term care system, but our party is proposing in this election to focus on home care for 400,000 additional seniors using new technology through nonprofit and service providers in our community. And I think the key thing in this goes back to so many bits of work that we have been trying to do for years, to say that if we treat chronic conditions at home, if we provide the organizations in our community with the support they need, then we can help people remain at home longer and not need long-term care. That being said, our proposal is to end for-profit long-term care by 2028. We will do that by bringing the homes into municipal and nonprofit operation. We have seen during the pandemic that those homes had greater success rates in protecting their residents and providing higher quality care. We also believe in the 4 hours of direct care a day that the Registered Nurses Association of Ontario is calling for, and we have costed that proposal as part of our platform for long-term care in Ontario. We're proposing 30,000 new spaces and 28,000 renovated spaces, and again, that will be municipal and not-for-profit operators. Fundamentally, folks, we believe that the pandemic has taught us that the long-term care system should be part of the public health care system. And the operators that have worked so hard, our municipal not-for-profit operators who continue to provide a very high standard of care, we want to support them in growing the number of spaces. But I want to return to home care, and we're going to talk about this again later tonight. You know, helping people remain at home longer with supports will require an investment fundamentally in the people who deliver those supports. I know from talking to people door to door over the last couple of months, the kind of challenges in trying to access those supports in the community today. The wait lists are way too long. The system is under-resourced. And if we're serious about helping seniors stay at home longer and avoid long-term care longer, then we've got to fund those systems. And we've got to respect healthcare workers. Oh, a little bit of buzz from me. Can you still hear me? All right. I'll keep talking just for my last minute here. Okay. The last thing I want to say about long-term care is this. You know, for years, I'm a mayor. I've come through a planning system where we treat long-term care as an institution. It's even zoned that way. If you look at urban planning, municipal zoning, we call them institutions. And they should be considered residences. It should be considered a residential use. We should be building long-term care homes that are part of our community. So our proposal is to build smaller homes that integrate into neighborhoods. No more warehousing seniors in long-term care homes that are in industrial areas or other low-cost locations because it's a for-profit enterprise. Let's work it into our community. Let's see this as an essential part of public services and an essential part of our neighborhoods. By doing that, we can create a long-term care system that is better integrated with our community and has more supports, and ultimately, by removing the profit motive, will deliver longer and better quality care.
Thank you, Jeff, and thanks for bearing with that little bit of static. I appreciate that. So I'm going to repeat the question now for Beverly. What would you do to improve LTC for our growing senior population and ensure Ontarians across the province have access to well-staffed, well-run, and safe LTC facilities?
Good evening, and thanks for the question. First, I want to thank CARP as well for organizing this forum, and it's certainly great to be able to gather together again. Tonight, I want to share with you the Ontario NDP's vision of a system that helps older adults stay in their home longer with excellent home and community supports, and when they are ready, small nursing home communities that feel just like home. This is a system where we know there is enough well-trained staff to provide each senior the time and the attention that they deserve, and where family members are partners in care and decision-making, not just visitors. This will be available to every Ontarian, regardless of how much money's in their bank account. While I'm answering the three questions tonight, you'll notice that I'm often crossing between topics because these issues are integrally linked. In fact, I'm going to talk about PSW staffing in detail in question 3. Each dollar government invests needs to be spent on care and not go to investors. And NDP government will phase out the existing for-profit operators within 8 years. This transition will be done by not issuing new licenses for the profit-based long-term care operators. Existing contracts with for-profit home care providers will not be renewed. Delivery of the services will be transferred to public and community health organizations. We will immediately enter into discussion with for-profit operators on the orderly transition to a not-for-profit operation. We will systematically redirect public dollars towards public and nonprofit homes, including funding for refurbishing and building. Legislation will prohibit the closing of any beds by the for-profit operators during the period of the transition. Homes will be required to meet all care standards and will be subject to regular, unannounced inspections during the transition. Through this transition, we will significantly increase financial reporting, transparency, and accountability measures for the profit long-term care homes. We will provide direct financial supports to municipalities, not-for-profit, and other public sector and community healthcare organizations to help them take over the existing homes and to construct new homes. The next piece of our plan is to build small, modern, family-like homes. No one should have to spend their final years living in an impersonal institution-like setting. The COVID pandemic has confirmed what seniors, families, healthcare workers, and experts have been saying for years. We need to stop building long-term care facilities that are essentially warehouse facilities for seniors. Home-like settings reduce the risk of infection, and studies show that home-like settings keep seniors safe and healthy because smaller spaces are better for people living with dementia who rely on familiar surroundings. Home-like settings also tend to have better working conditions for staff, which translates to better care for the residents. An NDP government will immediately start building small nursing homes that are based on best practices from around the world. We will have smaller living spaces shared by groups of approximately 6 to 10 people with shared facilities including kitchen, dining, and living room. As part of our capital investment of $750 million a year Over 8 years, to eliminate the wait list for long-term care, we will provide direct financial support to municipalities, not-for-profit, and other public sector and community healthcare organizations to help them take over the operation and ownership of existing for-profit homes. We will fast-track projects and move planned capital spending forward. We will invest the additional one-time capital costs needed to ensure that by 2030, every person who needs long-term care support will get timely access to it. We will ensure couples can stay together regardless of their care needs. While this may prove to be a significant one-time investment, it's an investment that must be made, as it's an investment we believe will bring long-term benefits to Ontario financially and to the quality of life for aging Ontarians for generations to come. And we will collaborate with family councils in Ontario and the Ontario Association of Resident Councils to create standard toolkits and training materials that will ensure that every long-term care home has active and strong family and resident councils.
Thank you, Beverly. So, Doug, I'm going to repeat the question one more time. What would you do to improve LTC for a growing senior population and ensure Ontarians across the province have access to well-staffed, well-run, and safe LTC facilities?
Well, thank you, Martin, and thank you for the very gentle ring. I hope I get a gentle ring as well, or that I beat the clock. Look, long-term care has been ignored for decades by all governments. This shouldn't necessarily be a political thing. It's something that is in the pipeline and wasn't dealt with for several years. We finally made a commitment to address the situation, to move forward with it. And there are really three pillars: staffing and care, accountability, and enforcement. We put in the Fixing Long-Term Care Act our commitment to establish the 4 hours of daily care that each of us has referenced. We've already moved on that. That's in the Act, and that's moving it up from the 2.75 hours. We've strengthened the Bill of Rights for seniors, the Residents' Bill of Rights. We're doubling the fines and convictions. We are investing $20 million to hire 193 further inspectors, which will be one for every 2 homes approximately, the highest standard in the country. And that's part of the enforcement piece. We're building 30,000 new beds and refurbishing 28,000 on top of that. Now this is the interesting thing about some of the debates, is that you get a chance to see the differences amongst us. And my 3 colleagues would nationalize and put all the money into transferring ownership. We want to put the money into actually building net new beds. And I think that's an important piece. We have to build more beds because the premise of the question is about the growing population. If we don't build new beds, we're just making the situation worse. And the Liberals between 2011 and 2018 built 611 beds in the entire country, or in the entire province rather. We've done 278 to be specific, new beds just in this riding alone. That's new beds. Upgrading spaces, 234 for a total of 512. We've almost done as much in this riding alone in the last 4 years as the Liberal Party did in its entire tenure. We have a lot more to do though, because really one of the choke points is the human health resources. It's the individuals who are actually providing the service. We need more. We need 27,000 more PSWs, nurses, and doctors. We need the nurse practitioners. When I was here 4 years ago, well, it wasn't here, but when we were doing the debate 4 years ago, we talked about PSWs. We talked about the challenge that half that go for training don't actually practice as PSWs, and half that do go don't stay. And that's a real challenge. One of the challenges was wages, and that's why we've made the wage increase permanent. That's just part of the puzzle. There's a lot more to talk about and how we do that. The other piece of the puzzle is the nursing degree, and we've now made it permanent, and we've transferred that individuals can complete their nursing degree at Georgian. What was happening, they were doing their last year down at York, so that although we had local nurses being trained, they were leaving the area and they weren't coming back. So we've addressed that problem with colleges and universities, colleges around the province, and Georgian is one of them, so I'm very proud of that. We've made improvements to our nursing homes, and Jeff referenced sort of being in communities. Well, we have Victoria Village, we have Sarah Vista, we have Owen Hill. They're all in residential areas. And we've invested $1.5 million just in Victoria Village, upgrading rooftop units for improved air quality, for PA systems, heat pumps, very practical things. And we have to do more of that. But I agree with all of them. Home care is critical. We have to do better in home care. And we've invested $1 billion, proposing over the next 3 years to expand home care even further. That'll help 700,000 families. And on top of that, another $500 million. I see him getting up, so I'm going to get the bell.
No, not yet.
We actually put that commitment in the fall of 2021, so it's not a new commitment, but we'll follow through with that to expand home care services, to keep people in their homes longer. And in a later question, I'll talk about the free dental care for seniors 65 years and older, low-income seniors. It's helping 100,000 people across the province. And we've put real money into Barrie services to make that a reality. So thank you, Martin. I'll wait for the next question.
Great, thank you, Doug. So yeah, just to clarify to you, you'll probably see me get up a little bit before the bell, so you don't have to rush when I get up, just so people don't go by that. So very similar for the format for the second question. I'm going to read the background, then ask the question specifically. The order I'm going to go in now is we're just going to move down one and kind of shift down one. So Jeff, I'm going to ask you first, then Beverly, then Doug, and then Elise. So the background for the second question, and the question is, do you support our call to drastically cut wait times? Are you satisfied with the state of the Ontario healthcare system today? All your constituents who have experienced the wait times certainly are not. Will you make the necessary and long overdue changes in our healthcare system that lead to unacceptable wait times? Shortages of doctors, nurses, specialists, and diagnostic equipment put everyone in a queue for care. Why is there only one doctor in an ER with patients waiting hours for care? Why does it take months to see a specialist? Canada spends near the top of the OECD countries, but has an outcome near the bottom of wait times and access to care. Delayed or postponed surgeries affect seniors disproportionately and their quality of life, as well as their ability to remain independent. So the question I'm going to pose, starting with Jeff, will be, how will you cut wait times and address the shortages of doctors, nurses, specialists, and diagnostic equipment?
Thank you very much for the question. And the short answer, again, is we're going to respect healthcare workers and invest in the people we need in the system. I'm glad Doug mentioned, the situation with access to care. Our service wait times are longer. Our ER wait times are longer. The government did not get it done in terms of improving the system. You can't have legislation, Bill 124, that limits pay increases for nurses to 1% at a time of 5% inflation and expect people to stay in the profession. It is no surprise that I'm knocking doors and talking to nurses who have moved out of the public health care system because they're being asked now to take a 4% pay cut every year. And you know when you have to offer a retention bonus to fix your previous policy that you've got a problem with your basic legislation. So one of the first things the Ontario Liberals are proposing to do is, of course, scrap Bill 124, which limits nurses and healthcare workers' pay increases. We are proposing 3,000 new beds in the hospital system, $1 billion to try and clear the backlog of procedures that has resulted from both COVID and the underinvestment in the Ontario healthcare system. And that includes, by the way, MRI and CT capacity, which are two of the most critical pieces, diagnostic pieces that we need in the system. We're also proposing to spend $224 million, and the number is less important than where we're proposing to spend it, on community health centers. And this is what I want to talk about just for a couple of minutes. You know, as mayor over 12 years, I started to see how reactive we are in building our public services, and most of all, human services in healthcare. We wait till people get sick or have a problem, and then they need acute care. They need an ambulance. They need an ER. What we should be doing is investing before they need that crisis service. And we should be investing not only in the expansion of our hospital, which we will need in a growing community, but in the alternatives to hospitalization. This is so important. We need more hospice space, we need more long-term care space, we need more mental health and addictions, inpatient treatment, and we need more supportive housing. It's not a coincidence that the University Health Network in Toronto invested in affordable housing, supportive housing, with services on site. You know why? Because it kept people out of their ER. one of the best and most sustainable ways that we can reduce the pressure on the healthcare system over the longer term is by investing in the alternatives that will help keep people out of hospital beds in the first place, or give them the alternate level of specialized care that they need in what happens to be usually a lower cost environment. But specifically to the question, our platform proposes to invest, first of all, in our healthcare workers. And I think it's a tragedy what's going on right now, and what I'm hearing from people, whether it's doctors, nurses, hospital support workers, or otherwise. If anyone thinks the situation in our hospitals has got better, it is still, day to day, an enormous struggle here at RVH and in hospitals across the province. And it's not just because of the pandemic, it is because of a system that has been continually underfunded over the past 4 years, and particularly because we have had legislation that disrespects healthcare workers and is pushing people out of the profession. The most important thing that we can do to reduce wait times and give people the care they need is have a collaborative and supportive relationship with the people who have just spent 2 years getting us through one of the most difficult times in our history, a global pandemic. Thanks very much.
Thank you, Jeff. So Beverly, I'm going to repeat the question for you. How will you cut wait times and address the shortage of doctors, nurses, specialists, and diagnostic equipment?
Thank you for the question. So the concerns I'm hearing from you are my concerns about the current state of healthcare in Ontario. I'm also worried that this system has been allowed to fracture under the last government so that they could sell privatized healthcare to the people of Ontario as the only solution. Our healthcare system's been struggling from decades of cuts by both Liberal and Conservative governments, and we can't continue with Band-Aid solutions. There needs to be investments, but wise investments. Investments that solve the problem. Under the Ontario NDP plan, we will restore hospital funding and make sure that it keeps up with inflation, population growth, aging, and the unique needs of community, like the needs of rural hospitals. We will place a moratorium on further layoffs of nurses and healthcare workers, and we will complete a comprehensive review of staffing needs with healthcare partners. Our goal is primary care for all. We will prioritize badly needed hospital projects and expansions to ensure growing populations get the healthcare infrastructure that they need. We have to scrap Doug Ford's unfair wage cut bill, which prevents nurses and other healthcare workers from negotiating a fair wage. This has further demoralized those who've been on the front line working for us during the pandemic. To bring them back, we have to commit to good faith bargaining with the public sector. We will immediately take action to hire at least 10,000 PSWs and 30,000 nurses across the healthcare sector. We will create new jobs for late career and recently retired nurses to mentor and supervise. We'll create a job matching program to guarantee internationally trained physicians get local expertise. We will immediately take action to begin hiring 300 doctors in Northern Ontario, including 100 specialists and 40 mental health practitioners. There will be more funding for nurse practitioner-led clinics, and we will expand community health centers immediately, adding 20 newer satellite centers in communities where they are needed most. We will create more residency rotation positions to help retain doctors in the north, and we will foster stronger relationships between practitioners and social service providers to create a robust team of care. Our plan is to support nurse practitioner partnerships with doctors and specialists to expand access to services and comprehensive care. We will urge the College of Physicians and Surgeons in Ontario to expedite the process for international medical graduates. And there needs to be a practical investment to eliminate the surgical background, and the public need to know our progress. There will be an expansion of operating hours over into evening and weekends to increase hospital capacity, and we will engage in a healthcare worker hiring blitz and create a centralized referral system. We will identify and publicize the number of delayed procedures and publish regular progress reports, and we will make sure this gets done without privatizing our healthcare system. Additionally, there's some really, really important pieces in our healthcare plan to move this province towards wellness. We're going to treat mental health care as health care. We want to introduce dental care to every Ontarian, and we will work with the federal government to strengthen and accelerate the expansion of their dental care program. We will work to begin immediately a universal pharmacare system for Ontarians to complement Ontario's existing public drug programs. Our plan is to protect and strengthen maternal care, guarantee health equity, provide better cancer care and better end-of-life care, and we will end cuts and privatization and user fees. Also, there needs to be a refocus on public health. We're going to cancel Doug Ford's plan to force the mergers of public health units, and we will restore the province's traditional share of funding for these units. Then, we're going to work with these public health units to review the lessons from the pandemic and ensure that the public health units have the tools they need for the next pandemic. And then we will pass a Public Health Accountability Act to ensure that the Chief Medical Officer of Health is free to act in the interest of the public.
Thank you, Beverly. So Doug, once again, I'm going to repeat our second question. And the question is, how will you cut wait times and address the shortages of doctors, nurses, specialists, and diagnostic equipment?
Thanks again, Martin, for the question. And there are really three parts to this as well. It's about people, things, and processes. And I'll recap what I had said earlier about the people. We need 27,000 nurses, PSWs, and doctors. And so when we talk about where do they come from, how do we train them, it's pieces like making sure that Georgian College locally and other colleges have the ability to train them and graduate them and get them into the field. But we also need to be bringing foreign-trained professionals and making sure that if they have the credentials and they have the competency, that they're able to get to the front lines quickly. And we've passed a statute to make sure that that is the case, where a lot of professions have a domestic experience requirement, making sure that we minimize as much of that as possible if they're properly and fully trained in a foreign space. So in terms of dealing with people, we need to attract them to the system. We need to make sure that what they're doing is meeting the expectations, and that's going back to the 4 hours of care per day for residents. We also, though, need things being hospitals and equipment. And the most recent example that I have is the PET CT scan that we announced at RVH about 2 months ago, a month and a half ago maybe. They've been asking for that for about 10 years. They can service 30 to 40 people a day that would otherwise have to drive to Toronto. So it's not just about providing the services, it's about providing it where people live. And I'm very proud of that announcement. I can tell you, RVH, we've worked with them to work towards expansion in Innisfil to build capacity within the county. I've spent many hours with the other hospitals in the county as well, whether it be Soldiers in Orillia or GBGH. We have to make sure that we're working in concert, so we're providing the service and that they have the tools to do the job. We've spent historic investments in hospitals, an additional $3.3 billion in 22-23 alone. When it comes to the training, we've started new medical schools. The first medical schools that have been started in decades, one in Brampton and an additional one. So we need to be doing all of that. We also, though, need to be doing more in post-hospital care. So it's not enough to get people the diagnostics that they need to get them into the hospital. We need to do a good job about when they leave the hospital, giving them the appropriate care. And we are doing some innovative things. I can tell you the ambulance service in the county of Simcoe, in some areas, check in on residents who have not called them for an emergency. They're checking in to make sure that they're having the medication that they need, to make sure that things are going okay, to avoid those hospital visits. So there is preventative care happening, and we need to make sure that our processes are in place to maximize that. So again, we're providing, we are only going to reduce wait times if we have people to do the job, if we have places for them to do it, and they have the tools to make the job happen. So we're doing all of that. at the same time, and we're moving forward, and we have to continue moving in that space. And we can rhyme off numbers, all of us can rhyme off numbers, but the important thing is that we're putting those pieces in place for the system to move forward and give people the service that they need. And I'm very proud of the work that we've done. If you talk to anybody connected with the management of Harvey H., they have received virtually everything they have asked for from both myself and Andrea Kanjan, working very hard to advocate for them. And we worked on the expansion in Innisfil to provide even more. So very, very proud of what we've done. And quite frankly, what will we do? We're going to do more of it.
Thank you, Doug. Elise, I'm going to repeat the question one more time for you now. How will you cut wait times and address the shortages of doctors, nurses, specialists, and diagnostic equipment?
To start, the Greens will increase our hospital-based operating funding to a minimum of 5% year over year, which includes increasing nurses' salaries. In our costed platform, that will provide hospitals with $2.4 billion over 4 years. It also means fast-tracking approvals for 15,000 international healthcare workers to help address the staff shortage, and by expanding the roles and scope of nurse practitioners as primary health providers, especially in areas that lack primary care options. Our vision is for an Ontario that cares for its people and the planet we live on. We do not want a province where patients linger in hospital corridors waiting for care, which is why we need to work with the federal government to provide surge funding that is specifically aimed at reducing the backlog in surgeries, imaging, and other delayed services, invest in new and expanded hospitals in high-growth areas, and improve diagnosis and OHIP-covered care for rare diseases, including, but not limited to, Lyme disease, long COVID, and chronic pain disorders. But funding hospitals alone will not solve all of our healthcare problems. We need to provide support and expand upon other types of healthcare services that help keep people from getting to the point of needing to go to the hospital in the first place, which is why we will invest $240 million over 4 years to increase options for primary care, such as community health centers and nurse practitioner-led clinics, to ensure access to non-urgent 24/7 care. We will also expand access to family health teams in communities across the province by providing $263 million over 4 years to increase opportunities for physicians to join team-based models of care, which will include a diverse array of healthcare providers to ensure a holistic, connected, and comprehensive approach to health. We will also expand funding to build additional hospice residences and fund all critical costs related to palliative care, including support for grief and bereavement services. Reducing wait times and backlog also has to do with a lack of coordination between family health centers, walk-in clinics, specialists, and hospitals, which is why we will focus on improving integration and connectivity across healthcare service providers through the use of digital data sharing and patient health coordinators. But I think while we are discussing our strategies for improving our overwhelmed healthcare system, we also need to spend some time talking about preventative care, which is why the Greens believe we must increase upstream investments into the social determinants of health, such as social isolation, housing insecurity, and poverty, to prevent substantial long-term healthcare costs and severe disease. Which is why over the next decade, we will invest $1 billion per year to build 182,000 affordable community rental homes, including 60,000 supportive homes with wrap-around supports. We will also implement a universal basic income, immediately double the rates of the Ontario Disability Support Program, and publicly fund take-home cancer and rare disease medications while we work with the federal government to implement a universal pharmacare program. We know that improving the social determinants of health keep our populations healthier for longer, so this must be a priority in any healthcare prevention strategy. And so should the promotion of healthy behaviors, such as nutrition and stopping smoking, to prevent disease and reduce risk factors. These early investments will lead to better long-term health outcomes and reduce stress on the system. And finally, people are starting to now better understand how environmental harm has a direct effect on our health, which is why prioritizing clean air, clean water, and access to healthy local food in all communities must be a focus in any healthcare prevention strategy. which is why we will protect our populations by saying no to Highway 413 and the Bradford Bypass, placing a moratorium on all new gravel mining pits and extensions of any existing ones, and implementing a grocery code of conduct that protects our local farmers, food producers, and consumers. Ontario's healthcare system was not prepared for COVID-19, and this public health crisis has exposed massive gaps in how we care for each other, which is why fixing our overwhelmed healthcare system requires an all-hands-on-deck approach that stretches across many services, from emergency to community care to prevention. Now is the time to learn from past mistakes so we can build a more caring Ontario.
Thank you, Elise. So that brings us to our question number 3, and the order we're going to go in this time will be Beverly, followed by Doug, and then Elise and Jeff. So again, the background for question number 3. Most seniors prefer to age at home. Do you support our call to immediately hire and train the needed PSWs and nurses to help Ontarians age in place? It costs over $1,000 to care for someone in a hospital each day, and an average of $103 to care for someone at home. There's a severe shortage now, and the demand will only increase. Ontario needs 30,000 net new PSWs to meet home care needs over the next 5 years. Perhaps you might consider an apprentice program with free tuition and base pay to attract workers at home and from abroad. Home care will save misdirected money looking after people in hospitals or long-term care homes when they could be cared for at home. And I'm going to pose the question now, starting with Beverly. Will you do what is necessary to find, hire, train, and retain those workers?
So the answer is yes. And everyone deserves meals that aren't rushed, and caregivers have time to listen, and the comforts in life should be basic, like a warm bath and clean clothes shouldn't be deemed non-essential. Decades of underfunding by successive Liberal and Conservative governments have led to a staffing crisis in long-term care and in home care, with for-profit corporations keeping staffing levels dangerously low with part-time and temp workers instead of full-time staff. That means staff are often run off their feet and unable to give the time and the care that is needed. Personal support workers are badly overworked and underpaid. In the absence of decent working conditions like a fair wage, job security, and benefits, personal support workers continue to leave the sector. For those that stay, they're often forced to work multiple jobs just to make ends meet. During the COVID pandemic, temporary and part-time staff were forced to move from one long-term care institution to another, one home care institution to another, which contributed to the rapid spread of the virus, putting residents and staff at an elevated risk. Andrea Horvath and the Ontario NDP are committed to creating full-time and well-paid jobs for personal support workers to ensure that staff are retained in the sector and that more people consider it as a viable career. We will give personal support workers a permanent wage boost of $5 an hour over their pre-pandemic wage rate. We will also mandate that employers pay personal support workers for their travel time and their expenses to get to home visits. We will promote increased universal wage benefits and pensions for all personal support workers. PSWs are not the only workers who are underpaid and overworked in long-term care and in-home care systems. In the first year of an NDP government, there will be a review to adjust all wages and benefits in the sector and ensure all workers are fairly compensated for the work that they do. This includes, but isn't limited to, registered practical nurses and dietary staff. An NDP government will legislate a minimum standard of care to increase staffing ratios and lower the staff to resident ratio. An NDP government will eliminate the use of temporary agencies, many of which take a portion of the workers' wages. We will restrict the use of part-time hiring instead of full-time jobs, then mandate the personal support workers must only work in a single long-term care home or in a single health care setting. This is one of the most important ways to reduce the spread of infectious disease among vulnerable seniors. Consistency of staffing is also going to improve the quality of care as staff become familiar with people's needs and preferences. We will establish a dedicated training fund for personal support workers. As seniors live longer, their needs become increasingly more complex. 2/3 of long-term care residents have dementia. Long-term care staff often have not received specialized training. Staffing shortages, increased resident needs, and inadequate training have created a perfect storm, and that has resulted in violence and burnout. These funds will answer a key recommendation from the Jaleese Inquiry to create new, permanent funding to provide training, education, and professional development for all long-term care staff providing care. We will ensure that healthcare staff also receive training in palliative and geriatric care. We will also create a provincial program dedicated to recruit and retain PSWs and develop an apprenticeship program so that personal support workers are paid while they're learning their jobs. Support from families can also be critical to residents' mental, physical, and emotional well-being, and family are more than just visitors. And as Ontarians age, family members take on additional caregiving duties, often juggling demands of childcare and busy careers. For many, this is a financial and emotional strain, and we know women often bear the brunt. An NDP government will create a provincial caregiver benefit program that will provide direct support to family caregivers who do not qualify for the existing federal tax program and for respite care. Do I have more time?
No, that was you anticipated me. I was on the verge. So I appreciate that. Thank you, Beverly. So repeating the question for Doug, I feel like everyone wanted to hear the bell, like you were referring to it, but we were right on the cusp. So that couldn't have been more perfect in terms of the time. So Doug, for the question, will you do what is necessary to find, hire, train, and retain those workers?
We're doing a lot of things right now, and I've mentioned twice, once in each of the answers, about the number of professionals that we need to hire and train, and the tools they need, and the places they need to work in. And so we are committed to the 27,000 new staff. And we're investing $4.9 billion, so effectively $5 billion over 4 years. And I just want to touch on, we're throwing around numbers, and these are big numbers. And so I'm just going to talk for a minute about a million and a billion, about the difference. A million seconds is 11.5 days, but a billion seconds is 32 years. So these are big numbers when we talk about billion. We're spending $5 billion to attract and retain, hire, and then we'll be giving them the tools and the places to work on top of that. We've $764 million is the $5,000 retention bonus to each person. That's what it costs. $764 million for the 5,000 retention bonus to the nurses. And look, nurses and PSWs, tough jobs, like frontline, tough jobs. And they have been there for us, for the people of Ontario, all through COVID, all the way through this process. And my niece was a PSW, my mother was a nurse. I have all the respect in the world for the dedication to their clients, to the people that they help. It's tough, and there are structural things that we need to change. There are structural reasons why PSW is a tough job. It's not just money, and it's not just the job itself. It's how the job works. And we talked about this 4 years ago. We've made some strides on it, but it's how they're operationalized. And so there's more work to be done there. We've announced $61 million to support the nurses, $18 million through the Ontario Nursing Graduate Program, to provide full-time benefits and salary for over 600 nurses, with a focus on recruiting in areas of acute and long-term care. Up to $8 million to add 800 nurses to the health system in targeted areas. $35 million to increase enrollment in nursing education programs in publicly assisted colleges and universities. And the spaces are available last fall 2021, and this past winter, 2022. We're introducing 1,100 new practical and 870 registered nurses into the system just through that. That's the kind of thing that we need to be doing. Giving people opportunities, giving them pathways, but then again, giving them the tools and the places to be. We've done the wage hike. We've made it permanent for the PSWs. That was an important piece of the puzzle. We can't just do structural and ignore the wage side. We've delivered 1.7 million as part of our roadmap to wellness for the mental health initiative. That's just locally. That goes through RVH, New Path, CMHA, the Canadian Mental Health Association, and the Community Addiction Services in the County of Simcoe. And RVH, the Royal Victoria Regional Health Centre, received $160,000 for nurse practitioners in support of the detox services. These very targeted investments are important to get us where we need to be in terms of hiring, training, and retaining, because it's not enough to hire and train. We need to retain. We need to make sure that they're in spaces where they can get the job done and where they can service the people that they want to. And I'll tell you, our government, I'm proud of this, our government was the first to introduce unlimited job protected leave. Now I'm going to say that again. Our government was the first in the country to introduce unlimited job protected leave so that nobody had to choose between their job and their health. And we also led the way as the first to legislate COVID-19 paid sick days. So that doesn't fit the narrative that you hear in the media all the time. But that's the kind of leadership that we're providing. And that's to protect those who are working in the system. Again, I'm very proud of the work that we've done, the investments that we've made. Beverly touched on food, so I just want to touch on that before I close. We have spent $40 million increasing the nutritional supports by 15% in long-term care. That's an important piece. That allows for more local and fresh produce, for more choice in food menus. That kind of quality of life is what we're trying to improve as we go. And I see that you're up, and I'm almost done, so thank you.
Thank you, Doug. So, Elise, I'm going to repeat the question one more time. Will you do what is necessary to find, hire, train, and retain those workers?
I absolutely support the call to immediately hire and train the needed PSWs and nurses to help Ontario's age in place. This starts by increasing funding to home care services, including in-home palliative care and dementia care, by 20%, which over the next 4 years would amount to $1.6 billion in spending. It also starts by mandating that personal support workers be paid a minimum of $25 an hour plus their travel time between visits. Registered practical nurses be paid a minimum hourly wage of $35 an hour. And as I've mentioned before, repeal Bill 124 and the problematic sections of Bill 106 to allow all healthcare workers to bargain collectively for fair wages. It also means fast-tracking credential approvals for 15,000 international healthcare workers, including nurses and personal support workers, and increasing nursing program enrollments by 10% every year for 7 years, and the number of trained nurse practitioners by 50% by 2030 to enable us to meet our target of at least 30,000 additional nurses, which we can do by supporting certification upgrades for healthcare workers through expanded bridging programs at publicly funded post-secondary institutions, and by providing support for Black and Indigenous healthcare workers through greater mentorship opportunities. But getting workers is not enough. We need to be able to retain them. And we can do so by establishing a nurse-led task force to make recommendations on matters related to recruitment, retention, and safety of nurses, as well as increasing the number of legislated paid sick days from 3 to 10, and banning employers from requiring a sick note from a medical practitioner when an employee is ill. And we can also do so by providing all workers with full and equal access to employment rights and benefit programs like EI, CPP, and WSIB, as well as equal pay for equal work, regardless of whether the employee is permanent, part-time, temporary, or casual. But this alone is also not enough. We must collect meaningful quality indicators to hold home care organizations accountable and to promote quality improvements. Create a standard basket of core home care services that providers must make consistently available across the province, and provide team coordinators as a single access point within family health teams to ensure care is consistent with patient needs. And we also know that a lot of home care comes from loved ones, which is why we will pilot a support program as part of a basic income phase-in for those doing unpaid caregiving in families and communities. I am also, again, committed to heeding the calls from the Alzheimer's Society's roadmap to a renewed Ontario dementia strategy by implementing all their recommendations regarding aging in place, which includes, but is not limited to, establishing and expanding the availability of integrated community-based care to retain the quality of life of people living with dementia, establishing local and regional-based care through coordination with Ontario health teams to ensure a client-centric approach to dementia care, and providing greater support to full-time employment through further compensation for professional development in dementia care. Lastly, we need to expand the different types of home care options available by making it easier for seniors to live together, by streamlining and simplifying the approvals process for co-housing and co-living developments, repealing laws that would prohibit or create barriers to co-housing and co-living, and increasing support for community centers and neighborhood coalitions, which play an important role in encouraging community connections and reducing isolation for elders. The reality is, seniors want to live at home for as long as they can, and helping them access the support they need to do so removes significant strain from our hospitals and long-term care facilities. And it also allows seniors to live out the remainder of their lives the way they want, which for the Greens is always our top priority. Thank you.
Thank you, Elise. So Jeff, I'm going to read the question, no surprise, one more time. Will you do what is necessary to find, hire, train, and retain those workers?
Yep. And I want to tell you how, but I think the most important thing in all of this is that you have to believe in building people up and paying them a fair wage. And, if you ask a healthcare worker right now, especially after the last 2 years, whether they feel respected by the government or not, I don't think you're going to get a positive answer. They've been there for us, but the government has not been there for them. There's legislation right now requiring many of these workers to take a pay cut. And you can't retain workers under those circumstances. It starts with a fair wage for a fair day's work. And it starts with, when it comes to PSWs, additional incentives to help people come into the profession. So I want to talk a little bit about our specific answer to that question, which is a $25 minimum wage for PSWs. And Doug's right, there's been wage increases implemented, but they are inconsistent. We are also proposing to fully fund tuition and forgive student loans for people who choose personal support worker as a profession, as a way to encourage more people into PSW positions. And I really want to talk about that fair and consistent pay piece, because it's about respect. It is about respect for an incredibly difficult job, or jobs, whether it's nursing or PSW or support workers or otherwise. I had the opportunity briefly to speak with Claudine Cousins around this, who runs Empower Simcoe, and one of the largest home support organizations in our region. And she was the moderator of the first debate that Elise and Beverly and I were at. And she talked about the importance of recruiting new workers, but retaining them because you provide a consistent pay across similar work. And right now, that's not the case. So you got to start from a basic point of view that says you want to invest in these services, not treat them like a cost center. We need a government that believes in public services and wants to invest in them. A couple of the things we did locally, over the last little while, I had the chance to chat with Shirley Sharkey, and we actually worked with her. She was the CEO of St. Elizabeth's. St. Elizabeth's has a school for PSWs here in Barrie, as you may be aware, and is the largest provider of personal support workers across the country. They're a social enterprise, a not-for-profit enterprise. And, her initiative with technology to provide more home care, her vision for the future of home care, was for her workers to be well-paid, well-trained, and equipped with technology that would allow them to form longer-term and lasting relationships with their clients. But to keep people in this very, very challenging profession, especially in the last 2 years, you've got to get some basic things right, and that includes fair pay, of course. I think the really important thing that I want to mention just in closing on this one, and I thank Doug for mentioning the paramedicine program that we set up at the County of Simcoe, and we're very proud of that program. That's where paramedics at times of day when they're not typically as busy, have lower call volume, They go and visit the people who call 911 the most to help them with their basic needs. Again, these are about solutions that keep people out of the healthcare system and help them stay at home longer. And paramedics love that job because imagine, most of the time you're seeing people in a crisis circumstance and you're not building any kind of relationship with the people you're helping. You have to help them in an emergency based on whatever call your ambulance receives. This allows them to build relationships with people, with patients. It's a wonderful program. We also did work at the City of Georgian College on home sharing, which is where students live with a senior, and in exchange for lower rent in a home setting, they provide some basic services at home. That's a program that helps students find cheaper housing, but it also helps a senior stay at home longer because they get assistance with cooking or basic tasks around the house. Most of all, what we need are sustainable solutions, so we're not sitting here every 4 years trying to make electoral promises to you. We're actually delivering platform and policies that will fundamentally change the system, that will help people live at home longer with the supports they need in the community.
Thank you, Jeff. So that brings us to the last of our questions. And before we take a break, I just wanted to thank everyone here. Elise Robinson from the Green Party, Jeff Liebman from the Liberal Party, Beverly Pacho from the NDP, Doug Downey from the Progressive Conservatives. Thank you for being here. We really appreciate you being here and having this discussion with us. I think it means a lot to everyone to be heard and to get those questions addressed. So the next thing we're going to do, we're going to take a short break, and we're going to resume for a much more casual fireside chat, kind of a one-on-one to get to know each of the candidates a little bit more. So thank you.
We fought our way through Italy and then headed for Amsterdam, sweeping for Germans along the way. Our worst fear was to catch a bullet in these last hours of the war.
I was 15 when the Nazis invaded the Netherlands. More than 100,000 Dutch Jews never came home. Our men were put into forced labor. By 1945, we were starving. The food drops gave us hope. And then the Canadians came.
Before Amsterdam, I couldn't have explained why we were there, all those years away from home, but the Dutch showed us why it mattered.
Papa wanted me to bring some soldiers home to thank them personally, and that's when I first saw Wilf, and I invited him over that afternoon.
Marguerite Blaise married Lieutenant Wilf Gildersleeve. They moved to Vancouver, where they raised 8 children. Today, the Dutch still remember the Canadians who liberated them.
So thank you. Welcome to our fireside chat. It's a very casual conversation. I'm here with Doug Downsey from the Progressive Conservatives. I'm Mark Marchand. And I'm just going to throw, people have seen me kind of meander around on the questions. I'm just going to throw a few casual questions, try to get to know you here a little bit more. So maybe tell us, I'm going to give you already a 2-part question. One is, so what got you maybe into politics, and does that tie into, maybe yes or no, into any of the hobbies that you're interested in?
Wow, that's a great question. I actually was a page in Queen's Park when I was in grade 8, and that was back in the time when Bill Davis was premier. And I had the seating chart, and it was signed by everybody. I didn't realize until last year when I found it in my father's basement that I had had it signed as a child. And so Bill Davis was there, and Frank Miller, who was two seats over, and he became premier. And Ernie Eves and Mike Harris were back row at the time, and Bob Rae was there, and David Peterson was there. There were 6 premiers in that space while I was a 14-year-old. But my family wasn't political, so I actually don't know why I got involved in politics. I didn't really engage until I was in my 2nd degree, and I got involved, and I just really like the ability to make change. It's really there's some things you can only do by politics.
Okay, and I'm going to meander right into my second part of the question, so then I'm still going to take us into maybe tell us a little bit about yourself, about hobbies, and maybe and I don't know, depending where you take this, maybe things that you've missed that you couldn't do as hobbies during COVID, or maybe things that you've done more during.
Well, something that I've done during the election more is a lot of walking. I don't have a step counter, but some of the volunteers have them, and I can tell you we walk, and it's probably the same for all the candidates, about 30,000 steps a day. I love people. I love talking to people. I love learning. When that door opens, you don't know who you're going to meet or what their background or their experience is, and I really get energy from that. So that is sort of a hobby in terms of new experiences and meeting new people. I like to travel. I've traveled some really interesting spaces, doing some really interesting things into the Middle East and Russia and different spots. Again, new experiences and learning things. And I'm a voracious reader.
And so I'm going to actually take it in terms of the travel. I think that's a great aspect. And I always like to bring it back to Barrie, where we're at. So I'm going to say in terms of traveling, whether it's Russia or somewhere else, maybe there are things that you've seen there in terms of different things you've done. And not necessarily Russia, but anywhere that you've traveled, that compared to something also that's maybe amazing in Barrie or comparable or very different.
Yeah, Barrie is a unique and special spot. It has absolutely everything. And even with my colleagues in Ontario, I say, come on up. We're like an hour. We're like an hour away. And we have 3 ski hills and hardwood hills, and we have all these great adventures. We have an agricultural base. We have really everything that a big city would need. It's all right here, and it's a great spot to be. I can't think of a better place in Ontario to live and work and play. And now, not to be too political, but broadband has been a challenge. And for people coming up here, we will have the entire province wired by 2025. And if not wired, then certainly connected by satellite. And that will only enhance the ability to live not just in Barrie, but in Springwater and Oro-Medonte as well.
I think that's a big challenge too. So again, meandering into maybe technology aspect, because you brought us into the obvious challenge people have faced, different, I think very specific to seniors too, whether it's Zoom or other connectivity issues or so on. So how do you see that in terms of maybe you've experienced yourself, maybe at the beginning of COVID, more challenges technically, like with Zoom or other aspects, and how maybe you progressed or how you solved them?
Well, I can tell you one of my roles is I'm the Attorney General, so I run the court system. And we have brought the court system forward by decades in years. And that's not a political statement. You talk to anybody of any political stripe who touches on the court system, they will tell you that. The Chief Justices have been great to work with. We have 3 Chief Justices in Ontario, Court of Appeal and Superior Court and Ontario Court. And we've all been rowing in the same direction to use technology. And it affects our rural and northern in particular, and low-income people who need the supports or need the access points. Some people, if they have a cell phone, only have like 100 minutes on it. So we've worked hard to make sure we have access to the system and the technology at the same time.
Thank you. And in terms of, because you talked about walking, so I was going to say in terms of maybe keeping a fitness regime, is that really, what you do in terms of walking, or is there something else? I'm trying to see maybe what other interests
I have aspirations of something else, but it's really mostly walking. I had a friend tell me you can't out exercise your mouth. So I do watch what I eat. I'm not fundamental about it, but I am conscious of it. But I do. You ask for other hobbies. I love reading. I love autobiographies. I love historical fiction. There's some great stuff out there.
And for autobiographies, could you give us an example or a few, maybe what really caught your interest?
I probably have the largest political collection in Simcoe County, if not further, of politicians from all over Canada. Primarily Canadian, that's my interest, and you get some really good insight into how the system works or doesn't work, and how it's changed over time.
And one question, so you're going to see me again meander into something a little different, perhaps, is so has there been someone maybe who inspired you? It could be family, a friend, especially during COVID, where you've seen them achieve something, maybe despite the challenges of what we're all going through.
You know what? It's got to be the kids. School, the challenges, the adaptability. You see, as adults, we're pretty resilient. We're able to see through something or see through a challenge. When you see kids, little kids, especially when they're like in kindergarten up to grade 2, when they draw a picture, you know how they draw the picture and there's long legs and then a little body, that's their perspective of the world. They only know what they see. And so it's been a real challenge, and it from a mental health perspective, to make sure that they're getting the support so that their new normal isn't their forever normal. And I think that's something that I've been very conscious of.
And I think that's something that, definitely we're all facing in terms of seniors as well, having those challenges during the times we're going through. So maybe what I'm going to throw it to now as well, with our time moving along, is Is there something that you want us to know about you, maybe they haven't had a chance to discuss yet?
Yeah, I absolutely love what I do. As Attorney General, it's been a privileged space to be in the center of the system. I jokingly say I have 3 clients. It's the Premier, it's Cabinet, and the Lieutenant Governor. I have no accounts receivable anymore because I practiced law for 20 years and that wasn't the case. But I can't fire my clients. So it's been such a privilege to be in the middle of the system, to do things for Ontarians and the public service side of it.
Was there something during the question I ask would be in terms of with COVID? Sometimes I think a lot of us miss something where, when COVID started, we went, I wish I did that right before, and, the social distancing started and things of that nature. And I guess we're hopefully moving in a more positive aspect, maybe when we can do them again. So is there something that you feel like on the cusp right before it started, maybe you wish you had done and then?
I'm not a person of regrets. I look for opportunities. Sure, there are things that I probably would have done, but you can't see around every corner. Other opportunities have opened up because of COVID. It gave me the chance to revolutionize the court system in a way that would not have been possible without the pressure. So, I don't really look back and say, oh, I wish I had have or I wish I could have. I'm pretty forward-looking and I'm a pretty positive person.
And in terms of traveling, so we kind of are meandering back again to where we were at before. Yeah. Is there a spot that you particularly, would like to go as well that you're really on your high agenda list?
I don't have one spot. I don't. I've really enjoyed the different experiences that I've had in different parts of the world. And I'm open to new adventures, but I don't have sort of the dream destination that I want to go to.
Okay. And so I guess I'm going to backtrack maybe again to, we've got, sure. So maybe just one more question. And then in terms of maybe, again, I'm going to come back to hobbies. So you talked about, I guess, walking and so on. Is there something other than the autobiographies as well that you really maybe is your stress relief?
I like building things. Everything from IKEA to just building from scratch. I've stick-framed additions on homes. I do electrical within my competency and then have others finish it. I love the physical. I grew up working on farms and roofing, and it's satisfying to see the physical structure come to be. If you're doing a haymow, which we used to do with square bales, now they cheat with big round bales. But I like the physical part of it.
And maybe were there challenges with that on a personal level as you're doing your hobby? Were you going, this is perfect, this is maybe more intricate? And
yeah, the challenges in terms of the physical part?
Yeah, whatever. It could be a mental challenge.
I can tell you, carrying a bundle of shingles up a ladder when I did it about 3 years ago was not the same as when I did it 23 years ago.
And I think we still have a little bit more time, so I'm just going to take you to maybe a non sequitur, but you mentioned electrical, but in different ways. So one of the questions, too, could be, obviously, we're going through gas electrical challenges. If you just want to briefly touch on that, maybe the viewpoint of electric and gas.
Yeah, 4 years ago, Chrysler said, we are out of here. We're leaving this jurisdiction, worst jurisdiction in North America to do business in. Here we are 4 years later, only 4 years later. They've reinvested $5 billion for electric battery plant. We own the 32 critical minerals for producing batteries in Ontario in the Ring of Fire. So when Biden in the U.S. talks about domestic supply of critical minerals, he's talking about our supply. So we've harnessed that, and now we have Toyota and Honda and GM and Ford all expanding and investing in hybrids and electric, and we're recreating the auto leadership that was in Ontario.
I think that's, thank you then. That's perfect. Unless we have 1 minute to go, maybe just a quick closing remark.
Well, just thank you for hosting this for CARP. I really love the format that we went through. I think we each had a chance to say something in a respectful way and get our story out. And I'd encourage this again. I really enjoyed the format. Thank you.
Thank you, Doug. I really appreciate you sharing all that information with us, especially the hobbies, getting to know you. Thank you.
Focus better.
Partner better.
Sleep better.
Breathe better.
Love better. Work better. Friend better. Unwind better.
Everything gets better when you get active.
So we're going to continue our fireside chat. I'm Martin Rochelle, and this is Elise Robinson for the Green Party.
Hello.
Thank you for being here. And again, just this is a chance to get to know you. And as you've already seen, I'm going to meander through maybe some random questions and kind of try to make some sense of it as we get to know you. So I'm just going to start off with maybe, again, tell us in terms of what got you into politics. And I'm going to go with the same. I'm going to say, can you tie it into maybe hobbies or not? Things that, piqued your interest.
Absolutely. I think if we go really back in time, my interest in politics started when I was about 6 years old. My mom took me to the polls one day, and she really wanted me to understand the process, so she gave me a little bit of an overview of what the parties were about, and I said, "Oh, Mom, you have to vote Green." And she did that time. She listened to my 6-year-old self. But personally, I got involved in politics in my second year at Carleton University. I became the head of events for the Carleton U Campus Club. The first event I ran, which was really important to me and really close to my heart, was I held a documentary screening that the documentary was focused on the homelessness crisis on Ottawa, and we actually got to bring members of the houseless community who were featured in the film to come speak about their experiences and what they needed. And I think that that was really a defining moment for me in being involved in politics and knowing that I wanted to be there to help people and to help tell their story and help build policy that would make their lives better. And I think, that was really important to me as well, because at that time in university, I personally was struggling very deeply with depression, and the weight of the world was really hitting me. And I think doing those events and connecting with members of the community gave me a purpose that I was lacking at that point in my life. And since then, I've been involved in other green campaigns, and I've got to meet more people and connect more deeply. And I think that has brought a lot of joy back into my life and really shown me like what I want to be doing and why I'm here.
First, I always want to say, I really appreciate when people share their particular situations and when they bring that up, because I think it also really helps everyone else to know that someone else could be going through it. There could be other things as well. So maybe there's so many things that I can go back to, because I'm going to ask you in terms of maybe politics and family, but I'm going to ask you in terms of maybe how, in terms of coping with COVID. Did you find that there were certain ways that you developed, or maybe you could tell people that were good ways of coping with it as you went along, or maybe just challenges, whichever way you want to?
Absolutely. I think one of the things that helped me cope the most is, having a really strong support system of loved ones, of friends who you can sit down and really open up to and explain your struggles and your joys and just your day-to-day life, and knowing that there are people there to do that. And I think the best way for me and the easiest way I found doing that is going on walks in nature, being near the water, being in open spaces, watching the animals, all that stuff. Like that's really huge, and my friends and I really love to do that. I think another thing that really helps me cope is, meditation, sitting with yourself, breathing deeply, doing things like yoga. I think that really, really helps me. But it's also, it's not always easy, and you have to, be able to give yourself credit for the days where you don't do anything, where you have to sit at home and just sit and feel what you have to feel. I think, if that's the message I would want to leave with people, it's that don't push those feelings away. Sit with them, reach out to people, those you love. And, if you don't have a support system, there are things in place and systems in place that, you can receive help from. And that's something, I want to help increase, make that easier and more accessible for people too, because I'm very grateful to have a support system, and I know that that's not the case for everyone.
Well, I think we're also really appreciative of that, and sometimes the question, I think, of doing the best that you can under the circumstances we're all given. One thing I wanted to come back to as well, so you mentioned your mom, and just in terms of the question I was going to pose, not necessarily about your mom, but in terms of politics, like, did you find then that there were family members that were maybe drawn into, like, piqued your interest in politics, or was it more you driving it?
I think it was more me driving it. My parents have both always been really supportive of me and whatever I did. And one thing that I remember my mom telling me my whole life is that never just accept things as they are, always question why. Never let someone give you the reason because. And I think that that framework really, motivates what I want to do in politics and how I want to approach everything. So I think, that mindset, but I'm really grateful I have my dad and his partner here with me today, and knowing that they are here to support me and they help me drop off signs and are just really active in my campaigning. So I think their support, but I feel like the interest did come, just from myself.
And in terms of, I'm going to bring it back to hobbies, and although I know you already said yoga, so I mean, obviously that could also be a hobby or an interest, maybe more serious than a hobby, perhaps with the coping mechanism. But are there other hobbies maybe that you want to just let us know about, things that, because I think it's useful, because then people go, okay, maybe there's something that I can do during this COVID period that.
Especially over the last 2 years of COVID, I've been getting into cooking. My partner, he loves to cook. He watches cooking YouTube videos 24/7. I would say I'm the sous chef. I am not the head chef, but I really do. I do like to do that. That's something that's a lot of fun. I like to go for hikes. That's a really big hobby of mine. I'm also a big fan of reading, more fiction and magic realism, but yeah.
So naturally, I'm going to ask then, in terms of fiction, were there specifically really interesting genres or books specifically that you found, really worthwhile in the last while?
Yeah. Let me think about that one for a second. Gabriel Garcia Marquez is like one of my favorite authors of all time. Love in the Time of Cholera of his specifically is one of my favorites. But I've been reading some other books I've really enjoyed recently is Freshwater and Bunny. They're two different authors, but those are two books. Also very much in the magic realist type genre. That is my favorite. It transports me to a different world, and yeah.
And then I'm going to go, and again, as everyone's seen me kind of meander through, I'm going to bring us right back to cooking, because I think that's interesting too. So in terms of when you were doing cooking, any interesting challenges that you went, wow, this dish was hard to make, or this was a breeze?
I think that my favorite one to make, and probably, it's not too hard, not too easy. I just like to make a classic chicken curry. That's a really enjoyable one. I could do that all the time. Lettuce wraps I really like to make. I think my biggest challenge is cutting vegetables, though. I'm very slow. I've been told I'm very slow at it, so I need to start like half an hour before to make sure that I'm going to eat when everyone else wants to eat, so people aren't, hangry at me.
So it sounds like planning ahead of time, but you're anticipating it. Okay.
Definitely.
And then I'm going to go to question two, because we've covered a whole range already, but is there something that you're sitting here and going, okay, I wish you would get to that question, and I want to let people know about this specifically?
I think regarding myself and maybe expanding a bit more on my background, I studied journalism at Carleton, and it was something that for a while I thought I really wanted to do, but the more I was in the community with people and talking to people, as much as it's really important to tell people stories, I wanted to be able to change and impact the circumstances in which they were living. I think I was really, really inspired by a story I covered. It was a sit-in and ceremony led by Indigenous land defenders at the Justice Minister's office a couple years ago. And I remember in that moment being like, you know what, as much as I do really enjoy journalism, I want to affect change, and I really think that I can do that in the political forum. And yeah, if there's one area of policy that's really, really important to me and that I would champion if elected to Queen's Park is Indigenous rights. And, working towards reconciliation, I feel a really huge responsibility as a settler who's had family here for a long time, who, indirectly have caused harm, to do whatever I can to reduce that harm and create justice for Indigenous communities. That's really, really important to me.
The other question I'm going to jump to now is technology-wise. So the question of what about challenges technology? Have you seen them differently at the beginning, maybe over COVID lockdown to now? And how have you coped with them, maybe, if you've encountered them?
I think one of the biggest challenges for me was just overconsumption on technology, using it too much and not spending enough time, out in communities, talking to people. And I think that can make you feel really isolated, and also can get you really stuck in an echo chamber when there are algorithms that are in place to feed you the information that you want, and keep you also stuck in patterns of thought. So I think something that I've learned throughout the pandemic is to know when to put my phone down, to give myself limits on it, to make sure that I am doing tasks that get me away from the screen, because as much as it is a tool that we can use for good, it also can cause adverse harm, especially on mental health. So making sure that I regulate that is something I've learned.
And in terms of, so me, I think you might have heard me say this question before. So the question I really like to ask too sometimes is, did you find that there was something that you really wanted to do before COVID started that you went, oh, I wish I really did that, and now it's a little more difficult, and I can't wait to do it, maybe when we're even less socially distanced, hopefully in the future, keeping an optimistic view?
Yeah, absolutely. I've always wanted to, well, I actually did go when I was 5 years old to the Terceira in the Azores, where my grandmother is from, and I wanted to go with her a couple years ago, but with the pandemic, it wasn't possible. And that's been something that I've been really wanting to do, and actually we are finally going to be able to do this summer, so I'm really, really excited to go back to her home with her and meet some of her family who, I don't remember from when I was 5 years old, so that's a really huge thing for me. Yeah.
Okay, and I don't have my bell with me too, but we're heading into, I think, 30 seconds left as well. So within that time frame, is there something else that briefly you want us to know? And then
I just want to thank everyone for coming out tonight, for listening to us. I want to thank the other candidates, Beverly, Jeff, and Doug, for being here and sharing their thoughts. It's really important that we have these conversations, and yeah, thank you so much.
thank you very much. I appreciate it, you sharing all that.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
So we're here with our fireside chat. I'm Martin Rochon, and joining me is Jeff Lehman for the Liberal Party. So Jeff, you've already kind of seen me meander through the questions a bit, so going back and forth. But I'm going to start off with maybe asking, let's talk about your hobbies. So I'm going to start with just that, and if you want to bring that into maybe how that drove politics for you, if it did or it didn't, great.
Oh, okay. All right. So, well, like the political answer on hobbies would be like, here is my 5-point plan on hobbies. Number one. No, honestly, I haven't been able to do my major hobby during COVID, which is drumming. So I'm a drummer in a band. When I became mayor, I'm still in this terrible cover band. And it's how we raise money. It's actually how I raise money for charity. When I became mayor, a lot of mayors have galas or golf tournaments, that sort of thing. And we decided, I didn't want to do that because we'd take away sponsors from existing charity events and those sorts of things. So I decided we'd just keep up with the band. Haven't been able to do that for 2 years, which has been really, really difficult. I got a little bit of playing, but so I had to find other hobbies. And I guess, I don't know if it's a tie into politics or not, but like everyone, I think I finished Netflix during the pandemic, and I do really like the documentary section. I've learned so much. I just watched that 3 Mile Island series. That is fascinating. I had no idea. I mean, I've been involved in the power industry a bit over the last 10 years, and you just learn about human reaction to crisis, and you can learn a lot from the things done wrong. I actually agree with Doug about that. But the other thing I'll mention is board games. I was a board game geek before COVID. Now it's running rampant. We have shelves overflowing with games. Like 1977 called it. It wants all its retro board games back.
Well, I appreciate that, Jeff, and I was suggesting before that when we expand the fireside chat, maybe we would have people do their hobbies. So I don't think watching Netflix or board games, but maybe drumming would be an interesting thing we could do. So I'm going to go to the question of, in terms of, I know you've missed out a couple of things, but are there things that you find that are challenging specifically in Barrie for us to do? that you really, really wanted to do, and you're more limited now, maybe, or not, or maybe there's a different approach?
Oh, no question. Yeah, I mean, obviously, we're a city of festivals. I've been so proud over the time. Still got sound there? So proud over the time I've been mayor that we've been able to build some of those things up and create events that people could really enjoy on our waterfront. We could use to bring people to town. And of course, COVID has put so many of them on ice for 2 years. So that's something I'm really looking forward to this summer is some of the big events in our region happening again. Sort of the granddaddy of them all is Kempenfest, but even already we've been able to do some of the programming in the squares and so on. And I just think, you know, one of the biggest victims of the pandemic, of course, was our personal interrelationship. I look back over the last 2 years at the number of relationships that I had that just went on hold, and I see people now and I think, I haven't talked to you in 2.5 years. I used to talk to you every couple of weeks or see you at something. So that's why bringing these things back together, and maybe this is a little political, is, you know, when you invest in public spaces and public services and the places that people gather and the events that we can enjoy, you rebuild those connections. And I really think that's going to be important this year and the next few years.
So the next thing I'm going to ask you, Jeff, as well, is during the COVID, as we're going through it, and I know there could be maybe more than one answer, but maybe if you can give us a top one or two, in terms of maybe being inspired by people that you've seen during COVID, in terms of things maybe they faced and you went, wow, this is really impressive, specifically, they've really overcome it. Would there be something that maybe springs to mind?
Sure, I'll give you 2 examples. One is a small business in town that pivoted is the word that everybody uses, right? They shifted what they were doing. They're a craft brewery in Barrie, and they shifted over to making hand sanitizer, both alcohol-based products. and you know, they did that so quickly. The willingness to simply say, you know, I'm going to put down my core business and do this because this is what my community needs right now. And the woman who leads that, well, it's Redline Brewery here in Barrie, you know, the way that she moved everything, heaven and earth, to sort of shift production there out of what is basically a small business in the South End was just remarkable. And you know, business after business had to try and adjust to try and keep people's jobs and keep their business going. And I just admire that, the people who were faced with something that they never thought was going to happen and made that change. But the other thing I would say is, you know, there was this program that we were very honored to be part of in the mayor's office for age-supportive communities grants from the federal government. And what that allowed us to do is give people technology. And it was seniors in long-term care homes and retirement communities here in Barrie that got iPads. And we were able to put some Wi-Fi infrastructure and so forth into places that didn't have it. And what was so inspiring was to watch that the staff in those places who called us and said, can we get some of this technology, to then use it to make those personal connections to the families. I mean, they were struggling with IPAC, infection prevention and control, all of the things they had to do to protect people. And yet they went further. And I remember talking to this manager at a retirement residence in the East End of Barrie, and what she had done to set up these connections for her residents to their families was just amazing. I mean, the heart was incredible.
And I'm going to right away jump into something else as well, sure. Jeff. So in terms of, how about in terms of traveling? I know I've talked about, now always bring it back to Barrie and comparison points, but is there maybe a spot too as we're sitting here, and I guess maybe travel will open up soon, we'll see, it's always optimistic viewpoint. Is there someplace other than Barrie maybe that's on your list as well, and maybe why?
Oh, sure, there's lots of places I'd love to go. Well, we were trying to get down to see Carolina's parents in Mexico right before COVID, and we haven't been able to, and her parents are getting on in age. So getting to Monterey, her parents are there, and that's a goal, and I'm hoping that happens soon. I will say in Canada, there's a really, really special place. If you have, lots of people are familiar with Quebec City. Within Quebec City is the home of the Huron-Wendat people. It's called Wendake. It's in the north part of Quebec, and I'm going to be really specific here. They have a hotel a tourist site where they've got a recreation of a Huron village, very similar to the ones that were right around here in this neighborhood of Barrie. But in that hotel, which is on a river that flows into the St. Lawrence down a steep hill, it's absolutely beautiful. It's been done with indigenous. The designers were indigenous from their community, and they built this wonderfully peaceful place right in the heart of Quebec City, where you can learn about the history prior to settlement and the incredible history of their people. There's a reason this place is called Huronia, even though many of the Huron left 400 years ago. So that's a place I'd like to get back to, and I encourage anybody to visit.
Thank you, Jeff. And I've given you relatively long questions to go with, so I'm going to go rapid fire and give you maybe a short, easy one. How about favorite comfort food?
Macaroni and cheese.
A favorite food other than comfort food?
Lasagna.
Okay, that's
also kind of a comfort food. I don't know.
And no one's judging too, because we all get our comfort.
Both were pasta, and I'm not sure the nutritionists out there would be happy with those answers.
And the one thing too, I want to give you an opportunity as well. We went through a number of different things, but maybe is there still something else that you'd want to basically speak on briefly in terms of that you want us to know, especially going into this election?
Yeah, I mean, I got into politics to have an impact. It's been a tough 2 years. It's been an intensely rewarding 12 years serving the people of Barrie. And I'd really like to continue to serve the people of this riding, Barrie-Springwater Oro-Medonte. I think I have some experience that I can bring to Queen's Park on your behalf. But at the core, the thing I want people to know about me is that, the reason I'm here is to try and make positive change. And our party has always been the socially progressive, fiscally responsible voice of reform in Ontario and in Canada. And that's why I chose to run for the Liberals. And I want to bring that philosophy to being a member of provincial parliament and hopefully continue to contribute to our community.
The next question I'm still going to ask you is in terms of technology. So I would imagine that you've experienced different challenges. It's a question I asked before in terms of maybe at the beginning of COVID as how we progressed. So maybe if you can, if one comes to mind, if you can speak of one and maybe one that you overcame as COVID went on.
Well, I'm with Elise. Overconsumption was a problem. I mean, we just all got on our screens and detached because we kind of had to for a while. I think, I've had a lot of people telling me I'm doing the wrong thing, especially when we pushed hard on the restrictions that were required for COVID. And I feel I stepped up to push the importance of vaccines in our community as a response to COVID and the importance of the restrictions that we had to ask people to follow to protect one another. Took a lot of abuse online for that. And that's unfortunately part of the job today. We've had this decline in the quality of the way we talk to one another, especially online. And so that's something that I hope we're not teaching our kids. And, we've got 4 kids in our household, and that is so important as we move forward, that we teach them how to use technology safely and respectfully with one another.
And then, Jeff, as you've probably learned by now, I'm going to meander right into something a little different, too.
Sure.
So, but let's go with movies. And I'm going to be, or documentaries, because you mentioned Netflix. So I'm going to say, and you can keep it broad or you can keep it right to the point. So maybe something where you've really saw something that's great recently. It could be documentary, it could be movie, and maybe let us know why.
Geez. There are some incredible movies lately. Now, I'm a sci-fi fan, so I do admittedly use movies as a little bit of an escape. Star Wars, the latest 3, I'm actually a big fan of the most recent 3. I'm a child of the 70s, so the first 3 were great. The next 3 were awful, and the latest 3 were pretty good. And I watched that with my 13-year-old who loves those movies too. But yeah, I think, a lot of stuff's been sort of rushed out during the pandemic in terms of content, but boy, there's so much you can learn. And I guess the last shout out I'll throw on that answer is David Attenborough's Blue Planet. Aside from it is the most visually beautiful thing I think I've ever seen on a TV screen, there's something about that guy's voice. I watched in the 80s, I was a fan of David Attenborough as a kid. And listening to him, he could read the phone book. and it would be peaceful and wonderful and a great way to spend an hour with your family.
And we're going to end on that, Jeff. So thank you for bearing with me as
Watch
we went
Blue
through
Planet,
a variety
everyone.
of questions.
Thanks,
But I
everyone.
really appreciate you sharing and joining us.
Thank you. Thanks, Liz.
You must be the reporter. Come with me.
So, Miss McGill, how does it feel being Canada's famous women engineer?
The real story is the work we've done retooling this factory.
To build the Hawker Hurricane?
Indeed. 40 planes last month with a capacity of up to 100. Our fighters are over England as we speak. Of course, it pains me to see airplanes mass-produced like boxcars or baby carriages. But in war, we make concessions in favor of innovation.
You must feel at home, though, managing all of these women.
I'm not here to manage women.
Well, you must admit it is an unusual job.
I'm the chief engineer here. I do what engineers do. That's all.
What are we doing now?
If we're to win this war, we need to know how she flies.
Elsie McGill was the world's first female aeronautical engineer. She oversaw Canada's production of Hawker Hurricanes during the Second World War, earning her the nickname Queen of the Hurricanes.
So joining us for another fireside chat, I'm Martin Rochelle, and this is Beverly Pacho from the NDP. So as you can expect, I'm going to be all over the place asking you all sorts of interesting and questions just to get to know you a little bit. So let's go with hobbies. So what... I
wish you wouldn't start there. So, I actually retired 2 months into the pandemic. So, all of my plans for my hobbies, the things that I would do when I retired to make changes in my life have really been slowed down. So, I am actually just trying to figure out what retired life would look like. But in the middle of figuring that out, I decided to take on running in this election as the NDP candidate. So that really has been a lot of what's kept me busy over the last year.
And having said that, though, too, I'm still going to ask you in terms of, so it might be difficult because I know some of us can't do the hobbies and so on, but so is there something that you found that you do for maybe decompressing as you're going through all this?
So family, friends. I took up kayaking. This year I curl, and I have 4 beautiful grandchildren, and I try and spend as much time with them as I can.
And in terms of, and I guess obviously because all of us are facing this, so because you mentioned your grandkids, I'm going to just take it in terms of technology challenges.
Yeah.
And maybe during different periods of, as we were going through COVID, did you find that you were encountering those, and how did you overcome them, or et cetera?
So 4 children in one household on rural internet, and they were working to do distance learning. So I actually got involved and tried to support the family by taking 1 or 2 of the children at a time. So I had the opportunity to see firsthand the challenges that children, parents, teachers were having with the forced transition into online learning. And it was really, really tough, very tough.
So I'm going to, and again, because everyone expects I'm going to meander a little bit, so I'm going to throw this at you in terms of, let's go with electric and gas in terms of what we're seeing in terms of maybe the pluses and the minuses now that as we're facing moving into, electric, potentially.
Transitioning power?
Yeah, in terms of,
Making the transition from gas?
Well, no, I mean, I guess the challenges that we're facing in terms of gasoline versus electric, or maybe some of your experiences with that, or...
Well, I'm actually not in a position to have a fulsome discussion on that portion. I'm relatively familiar with the platform, but I have no personal experience with that, other than my best friend's son drives a Tesla, and it's cool.
Okay, thank you. So the next part would be, I'm going to just ask you in terms of movies and books, in terms of maybe ones that you've really liked, or maybe ones, I'm going to throw this at you, maybe ones that you've really disliked, if there was either or.
So I have actually been reading Kate Quinn's historical novels on World War II. and I'm finding it really fascinating. They're telling true stories. For an example, about code breakers, females who were involved in the war effort and who were code breakers. I think the reason I find it so fascinating is because I'm realizing that the generation of people who could tell us those stories originally were not are not often with us, and I really regret not having heard from my parents and grandparents the stories. So it helps me understand better about what life was like for them through those really difficult years.
And in terms of, because we're talking about in terms of coping as we're going through COVID and the different strategies, what about maybe in terms of just food, in terms of comfort food or different aspects? Is there something?
Well, I really miss the fact that Linda's Ice Cream Hut wasn't open year-round. That's just about the nicest comfort food you can get in this area. So actually, as I had said earlier, I retired just around the time of COVID, and in my regular life routine, I was not the cook in my household, so I actually took up cooking. But once again, I was reaching back to family recipes. So making things that my mom and my grandmother had made in the past, like sloppy joes and chili. My grandmother ran a dance hall, actually, just out Highway 92 in Elmville. And so she had to make sure there was good, hearty food at the end of the night for people to enjoy. So I started pulling out the recipe books from those years and making those recipes for my family.
And were there any ones that really jump out at you in terms of just not the specific recipe, of course, but in terms of maybe dishes?
There was actually one heck of a chili sauce that I made. It was my friend, actually, who's with me tonight, Kathy. Her mother-in-law makes it, and they call it chow chow, but we found out we had the exact same recipe. We called it chili sauce in my household, so we figure in Ontario, everybody has some variation of the same recipe that came with their ancestors.
And then I'm going to take it in terms of traveling. Is there something that, I know we're busy right now with everything going on,
yeah,
but down the line, is there a specific place that you think, oh, this is where I'd love to go?
So, of course, with COVID, like so many, there was lots of plans canceled. I have a lot of places in the world that I want to get to see. I've never been to Newfoundland. Newfoundland was one of those places that I had planned to go to, but it got canceled because of COVID. And I was fortunate to be invited to participate in a conference in Australia 10, 12 years ago. And I always said the first year I retired, I was going back to Australia and do a full exploration of that amazing country. So I'm hoping that things open up and I'll be able to follow through on that plan shortly.
And then just a general question, just one where I want to give you an opportunity, maybe if there's something still that you want us to really know about you that maybe you haven't had a chance to share.
Sure. Well, as you were asking the other candidates questions, I was kind of thinking through what my answer to some of the questions would be. And it was a question of why politics? Why am I running? What made me interested? And I think it's important for people to know when they're trying to understand why they would want to place their trust in me as a member of provincial parliament, for me to let you know that while it was always my plan to run in a political election, it wasn't something that I was able to do until I retired. I had to make a living. I had to support a family. I had to do all of those things to make sure that my family and I were stable, so that when I did retire, I could do what I wanted to do that would allow me to fulfill some of my goals and my dreams. And this is one. I am a very strong believer in the New Democratic Party's platform. I am a believer in it because of the work that I've done throughout the years. I believe that that platform will fix a lot of what is broken, and I will advocate for that platform to become part of government reality, no matter where I'm sitting.
And the next question I'm going to ask you is in terms of being inspired during COVID. So if there's someone particularly, it could be a single person or a group, or if you want more than one person, that you went, wow, this is amazing. They've really achieved this during COVID. They've persevered.
So I'm going to go back, and I had discussed my grandchildren. I have 4, and they're all live in one household, 12, 10, 8, and 6. And so 3 years ago, do the math the opposite way, the oldest was diagnosed with ADD through COVID and was struggling with learning online at the same time he was dealing with his diagnosis, and they were trying to establish a treatment plan. And it was really, really tough for him, and he persevered and he adjusted, and I'm pleased to say that even though he had lost probably a year of learning as a result of the struggles that he had, he's caught up most of the way and he's thriving. And so that speaks to the resilience of children, and that's a personal story from my life.
And I'm always very appreciative when people share that. Again, that really puts a face on something that people can see and we get to know you that way. I guess if we can go back to the question that I like also too about technology challenges in terms of Zoom and maybe connecting with people again. Was there something, did you find that those were challenges while connecting with family, especially at the beginning? Or was it, I guess, how was your personal journey through that?
So personally, I actually found Zoom to work well for me, but it didn't work well for the children. I found it was a fabulous way to stay connected with people that you wouldn't necessarily have been able to stay connected with. And it allowed people to come together virtually, even if not in person, and it helped ensure that nobody was isolated if they had access to technology.
And definitely bringing it to intergenerational, that's always the topic. So we're pretty much on the 30-second cusp of it. So I know we kind of went through a general aspect. If there's maybe within 30 seconds something else you want to add, I'm just going to give you that opportunity as well.
Well, thank you. I would like to thank CARP for bringing us all together and all of the candidates for the really important conversations that we had. I also want to just do a bit of a shout out. I think it's pretty exciting that there were 2 women at the front of the table. It's not easy for anyone to put their name forward into the political forum, but I think it's really exciting that we have women who are now ready, willing, and able to enter into the political discussion.
Thank you. I can't, again, I'm very appreciative of you sharing with us and joining us. So thank you very much.
Thanks for having me.
Thank you.